My name is Stephanie, and I'm going to speak to you tonight about drug abuse and how to overcome drug abuse. Tonight, I'm going to start off by asking the audience if they have been affected or know anybody who has been affected by drug addiction. Thank y'all very much. I myself have personally been affected with addiction along with most of my family and friends. We hear people who suffer from drug addiction need to be getting help directly through hospitals or treatment centers along with a recovery program. The first step is admitting we need help. The second step is getting the help we need in the area of recovery that we need. And the third step is living a life of recovery. According to the American Addiction Centers, 19% of people reported having used illicit drugs, where 35% of minors in grades 8, 10, or 12 reported having used any illicit drug in their lifetime. Drug use is most common in the 18 to 25 age group. 19.2 million people over age 18 had both a substance use disorder and a co-occurring mental illness. 17% of people with drug addiction or dependence had serious thoughts about suicide in 2019. Out of 42.1 million people with mental illness, 18.2% live with a co-occurring substance use disorder. Since 2000, over 700,000 Americans have died from drug overdoses. So I'm going to go on ahead and tell you a few things about myself and where I came from. As far back as I could remember, my mother was in an active addiction. And like my mother, I picked up on her addictive behaviors. As a teenager, I started with alcohol and using other vices that I became addicted to. And what spiraled from that was major depression, suicidal tendencies, and I carried it into my 20s, 30s, and into my early 40s until I finally said, I need help. Once I finally said I needed help, I got involved in a recovery home. I started working the 12 steps. I chose Celebrate Recovery as my method. After working the 12 steps, it just kept being an ongoing thing. Today, I'm over 4 years clean, and I do not suffer from the suicidal thoughts that stemmed from the long-term abuse. Now, my mother, on the other hand, she lost her battle with her addiction. She wasn't as fortunate. I have so many friends on a weekly basis, people that we know firsthand that they lose, whether it be the drug that they take was laced with something that they didn't know of, or they just lost it due to the suicidal tendencies. Drug abuse and substance disorder are more likely to affect young males, they say. It's kind of scary for me. I have 2 sons who both, in fact, suffer from addiction. 22% of males and 17% of females use illegal drugs or misuse prescription drugs within the last year. 10.1 million or 3.7% of Americans misuse opioids at least once over a 12-month period. And that was basically my downfall, was opioids. It started from one simple surgery to the next and just needing more and more and more, and then doctor shopping. And that's very common in the United States. And when you're not doctor shopping, you're doing anything you can to get the drugs. And when you can't get that, then it turns to substances like heroin. And we know that heroin today is highly laced with fentanyl, and it's highly lethal. Accidental drug overdose is a leading cause of death among persons under the age of 45. Over 700,000, like I said before, overdose deaths occur in the U.S. annually. The number of overdose deaths increases at a rate of 4%. So let's talk about the consequences of drug abuse. Often results in comorbidity. Nearly 50% of persons who have substance abuse disorder also experience mental disorder. Drug abuse affects symptoms and adversely changes the outcomes of infectious diseases. Abusers who inject their drugs account for 1 in 10 HIV diagnoses. There is a drug rehab success rate, though, of 21%, with those who finish remaining sober within 5 years. Many rehab treatment centers, they don't follow the rigid principles of the 12-step program like I spoke about. They instead follow holistic, faith-based treatment programs, and those do work. I firmly believe in faith-based. Celebrate Recovery is faith-based. It also goes along with the 12 steps. These sometimes result in spontaneous recovery, which of course supports the premise that the 12-step or medically assisted model are only two approaches. There is a small percentage of those suffering from addiction who are able to beat their habits on their own or without the need of a formal program. This may be through a combination of faith-based intervention, bottoming out, willpower, or facing a life-changing event. So when I go back to right after I had moved into the sober living home and my mom had lost her addiction, her battle with her addiction, that was when I decided to start spreading the message of hope from that day forward. It's very, very, very important to me. Any person that I'm around usually revolves around that world. Drug use is directly and indirectly responsible for 11.8 million deaths each year. Smoking, alcohol, and drug use is an important risk factor for early death. 11.4 million die prematurely as a result each year. Over 350,000 die from overdoses, alcohol, and illicit drug use. Again, like I said, we know many of people who it affects them, it affects someone in their close family or their friends. And if you do know of anyone or you yourself knows of anyone, then feel free to reach out to me and I can help get you somewhere that you would need to get to. And I thank you for listening to me today.